Sleep apnea is a very common condition that can have a serious impact on your health. To better understand sleep apnea, you should understand how your body is expected to work and how having an untreated sleep apnea can change your body's normal functions. Starting with the basics, your body is made up of cells. Many cells together create tissue that combine create organs. All of the cells and organs of your body need oxygen in order to thrive. You bring oxygen into your body by breathing. Your heart's job is to distribute the oxygen to all of your cells. When your heart beats, it pumps blood into the small blood vessels in your lungs. The air you breathe is passed from your lungs to the blood into the small blood vessels. This is called oxygenated blood. Oxygenated blood is passed to all of your body cells to keep them alive and healthy. Once the blood goes into all of your blood cells and organs, it travels back to the heart to repeat the cycle all over again. One of your brain's many jobs is to monitor the amount of oxygen in your blood. The brain manages the oxygen in the body by controlling the number of breaths you take in a minute. If your brain senses that there is too much oxygen in your blood, your brain tells your body to take fewer breaths. But if there's not enough oxygen in the blood, the brain sends signals to breathe faster or deeper. For example, when you relax, your cells are operating at a lower capacity. If you get up and go for a run, your body would move into a higher operation. All the muscles in your body would be called into action to support your running. To operate at this new level, your cells would need more oxygen, working together your brain, lungs, and heart. First, your brain detects there's need for more oxygen. Second, you breathe more quickly to get more oxygen. Third, your heart beats faster to distribute the amount of oxygen. When you fall asleep at night, you fall through different levels of sleep, from a light sleep to a deeper level of sleep called REM. During sleep, your body relaxes its muscle tone. The deeper levels of sleep, especially REM, are needed for your body's restoration and healing. Sleeping allows your body to rejuvenate muscle, regulate hormones, fight disease, reduce stress on the heart, calm inflammation in joints and injuries. When you have sleep apnea, the muscles in your airway relax to the point of blocking your airway. When blockage occurs, you stop breathing. This is called an apnea. Your apnea can last from 10 to 40 seconds. Remember that your brain is in charge of detecting the level of oxygen in your blood. When it detects a lack of oxygen, it signals your body to breathe faster and for your heart to pump harder. Detecting this emergency, your brain signals to release a stress hormone called adrenaline. This adrenaline shocks your system to wake you up just enough to regain muscle tone. Your airway opens, allowing you to breathe again. And with breathing restored, your heart slows and the oxygen levels in your blood return back to normal. When your apnea is over, you fall back asleep and your airway relaxes, allowing the complete cycle of obstructive breathing to repeat all over again. This cycle may repeat up to 100 times or more per night in certain patients. The most common symptom of sleep apnea is chronic fatigue. Although the person was unconscious for 8 hours at a time, they were not truly asleep due to the repeat apnea and the adrenaline cycle. But fatigue is not the only effect of sleep apnea. Serious health conditions, both immediate and long-term, can arise if left untreated. The repeated release of adrenaline can cause high blood pressure, congestive heart failure, heart attack, stroke, diabetes, obesity, arrhythmias. The release of adrenaline also changes your blood sugars, and if you are diabetic, your blood sugars can be difficult to manage during the night. And untreated sleep apnea can make this even more difficult. As you can see, your body is made up of many complex systems that work together to keep you healthy. Correcting sleep apnea helps the body regain the normal balance and functions and improves quality of life.
We said that pharynx has 3 parts. The first part related to the nose, we call it nasopharynx, and the second part related to the mouth is oropharynx, and we call the last part in the lower hypopharynx. So inside the nasopharynx, the problem that may block the airway is this symptom. If it is deviated to the right or to the left, it may block partially or completely the air. The turbinate inside the nose. These turbinate, if they are hyperdeveloped, it may block the nose. And also a polyp nasal, if it is developed inside the nasal cavity, it may block the airway. Also we have the adenoid, we make it here. The adenoid If it's overdeveloped, it may also block the airway. So these four things that we have to watch while we are examining the patient. The second part of the nasopharynx, we call it oropharynx. Oropharynx, we have to check the palate. This palate, soft palate, when you examine the patient, say ah, and it is all the soft palate cover all it, then you are in category 4 and you are in a long soft palate. And you have to do something about it, we'll see. Or the uvula. The uvula is long, or it is bifided, or it is very loose. Then also you have to take it in consideration of blocking the airway. After that, we have the microglossi. If you look to the tongue, if the tongue is very big, it may take more space than what it needs, and it block the airways, especially for people who breathe from the mouth. Or even the people who breathe from the nose, but when they are in position supine, they are sleeping, then the tongue go back because of its volume, and because it may be relaxed also, it goes back, and also because of the gravity, the earth gravity, it block and it go back and to block the air. Also the retrognathia, when the chin is a little bit back, the lower jaw is back, then it takes the space of the oropharynx. And then we go to the lower hypopharynx. In the hypopharynx, we have only two positions, the epiglottis and the stenosis of the cartilage. So the epiglottis, if it is long, it's a block the airway, then the patient has a problem. So now here in Aruba, in my office, we treat apnea as the following. First, we put a Marpe in the palate, mini implant, assisted rapid palatal expansion, and they call it also MSE, maxillary skeletal expansion. This Marpe, we use it to expand the palate, and the expansion of the palate, it is done in the line. We have the midline, and we put a screw on the side and the other side of this midline of this suture, intermaxillary, but it open also suture maxillary palatine and also maxillary perigo and maxillary zygomatico and maxillary naso. So many suture open in a way that they make the mid face free, easy to move it forward and lateral. So I use it to correct the class 3 elastics or some case of asymmetry. Because the palate is the roof of the mouth, it is also the floor of the nose. Expanding of the palate will make the cavity nasal also expand. And then even if we have a problem with sterpinet or with polyp or deviation, that increase of the volume of the cavity nasal will let the air pass. In my office, so we use the three things to help apnea. First, Marpe to expand the palate, expand the nose. Second is a facial mask to advance the mid-face, the whole mid-face advance it. And third is elastic or MRI to advance the lower jaw. In this case, we free all the pharynx way from the beginning of the nose to the end of the entrance of the lungs. Some orthodontists, they use only advancing the lower jaw. That is a part of the problem. That's why the success is 20%. It's only for the people who has a problem in the behind the lower jaw. But if you have a problem behind the maxilla, it doesn't give any success. Some new technology, they are installing the electrode inside their chest to stimulate the tongue not to relax. And every time it relaxes, it gives a shock to wake up. It's not very easy way to use, and it is very expensive. Only the appliance is around $20,000. So add on it the surgery, add on it the battery. Some other doctors, they recommend the CPAP. The CPAP is not a solution. The CPAP is a way while we are waiting to get the appointment with the doctors if you need it. If you have any question, you can call me or write to me on my Facebook. Thank you very much.